Good day, dear friends. With you is Natalia on the channel Dr. Savkina, where I share my personal experience answering your questions. Today, we will talk with you about whether it is possible to get rid of the problem of increased sweating and what to do in this situation. Increased sweating is a condition in which our body with you excretes sweat much more than is necessary to maintain thermoregulation. Some people have been dealing with this problem since childhood, and after puberty, it usually subsides. Someone suffering from excessive sweating, in other words, hyperhidrosis, loses self-confidence, avoids various forms of physical contact, and primarily handshakes, joint sports activities, and dancing. Difficulties arise when working with various types of tools. Driving a car for sweat control several times a day requires taking a shower. As practice shows, many are embarrassed to turn to a doctor with this problem, considering it insurmountable. Various hormonal disorders occurring in our body can lead to increased sweating. In this case, hyperhidrosis is subject to correction thanks to the prescription of a course of hormone therapy. For this purpose, specialists prescribe INDOL 3. It is widely used for correcting hormonal background in women. Cyclodinone is prescribed to normalize prolactin levels. Loges, Regulon, and Mercilon are used for menstrual disorders. For the treatment of certain forms of hyperhidrosis, drugs that suppress the activity of sweat glands may be prescribed. I am referring to the group of anticholinergic drugs. However, it should be noted that these drugs are not suitable for everyone. And for people suffering from glaucoma and men with hyperplasia of the prostate gland, many of them are simply contraindicated. Ionophoresis has proven to be effective for treating excessive sweating of the palms and feet. Some specialists prescribe it for treating hyperhidrosis of the armpits, although its effectiveness significantly decreases in this situation. Botulinum toxin is considered a modern treatment for excessive sweating, injections of which are made into problem areas in strictly established doses. This drug really works for several months, after which it is necessary to undergo a repeat course of treatment. It's probably hard to imagine, but surgical methods are also practiced nowadays to treat hyperhidrosis. Though, from my point of view, it's associated with the saying, shooting sparrows with a cannon. Is there a more grounded method of treating excessive sweating, accessible to everyone among us? Of course. As an extreme aid, you can use a cold compress. This solution allows to constrict the blood vessels and thereby reduce sweat secretion. You can also normalize the work of sweat glands with the help of soda, dissolving a tablespoon in a glass of warm water. The obtained solution should be used to soak a multi-layered cotton swab and then rub the problem areas of the skin. A cheap and accessible means capable of neutralizing unpleasant odors and narrowing sweat ducts is potassium permanganate. For this purpose, a pale pink solution is used with which the problem areas of the skin are wiped 3 times a day. A 6% solution of apple cider vinegar is quite effective against hyperhidrosis, capable of normalizing perspiration and toning the skin. Dilute a glass of 6% apple cider vinegar in 5 liters of warm water and soak your feet in the solution for 20 minutes. This kind of procedure is repeated twice a week. In some cases, the solution to excessive sweating can be as simple as replacing regular soap with tar soap. You can reduce sweating and unpleasant odor with the help of sage, horsetail, mint, lemon balm, yarrow, and oak bark. From these herbs, they prepare infusions for wiping, foot baths, compresses, and general baths. By the way, you can solve the problem of hyperhidrosis by eliminating strong tea, coffee, chocolate, and cola from your diet. Do not overuse spicy seasonings and minimize the consumption of alcoholic beverages. Try to wear clothes and shoes made of breathable fabrics. And of course, minimize any stressful influences. You are with Dr. Savkina. Subscribe to my channel so you don't miss out on many new, interesting, and useful videos. And be healthy.